Hello, merhaba. I'm very pleased to be able to speak to you today. I have been asked to talk to you about quality standards in prevention as a means to improve the quality of preventive work. So the previous two talks gave, I think, a very good overview about the possible contents of prevention. And quality standards are a means to thinking more about the context within which interventions are delivered, as I will show in a second. I will structure my talk around 5 questions that I thought you might ask yourself. There are these 2 acronyms, EDPQS and EQUS. So the first 2 questions is, what do they stand for? And you will find out that the Q and S stand for quality standards. So I will tell you why quality standards are important and how they can benefit you and other members of the prevention community. And hopefully, by the end of my talk, you will think, I want to use these quality standards. So then, of course, you will want to know what support materials are available and where you can find out more information. So the first question, what is EDPQS? EDPQS stands for European Drug Prevention Quality Standards. I've also put here the Turkish translation. And they provide the first reference framework on high quality, specifically for drug prevention and based on a European consensus. I will explore these points in the next slides as well. They were developed from 2008 to 2010 through a project funded by the European Union, by the Prevention Standards Partnership, which is a collaboration of different organizations from different countries around Europe, not only including universities, but also health services and government departments. And they were published by the European Monitoring Center on Drugs and Drug Addiction in 2011 as a book. So essentially, the standards are this book. I've included here the front cover, and I was pleased. I went to a conference once, and I saw somebody had it on their desk. So this is what the book looks like. It's quite a thick book. Some people call it the big book on prevention. These are some of my colleagues in the Prevention Standards Partnership. Anders is in the picture. He's also sitting here in the audience today as a Swedish associate partner. So this is for the EDPQS project, you can find the whole list of organizations on the website. How were the EDPQS developed? Well, they're based on scientific evidence and expert consensus, because for a lot of questions about how to implement interventions, there is no scientific evidence available as of yet, or sometimes it would be not feasible to conduct such a trial. So in some cases, like for example ethics, we can only rely on expert consensus, really. We took existing standards. Paul mentioned the Canadian standards, for example. He also mentioned the Czech standards. Lithuanian colleagues also have standards, Spanish colleagues. So we took different standards and we combined them. We reviewed them and made one very comprehensive list. And then we consulted with over 400 people working in prevention in 6 different EU countries to talk with them about whether they think these standards are useful in practice and whether they are feasible. And that's how we developed that book you saw. If you open the book, inside you will find this project cycle structure, which is really the skeleton of the book. Every project stage corresponds to one chapter in the book. This is the project cycle through which we think prevention activities would run in a kind of ideal, typical way. So starting with, and actually, for the Turkish colleagues, with needs and resource assessment, going through formulating the program, components such as what are your aims, what is your target population, what is the setting where you're doing your work, designing the intervention in an effective way. This is very much what the previous 2 colleagues were talking about. So using an evidence-based approach, looking out there what works, cultural adaptation and so on, resource management, delivery and monitoring, evaluation of outcomes and process, and dissemination and sort of starting the cycle again. And then in the middle, we've got some issues that are always relevant, such as funding or staff or ethics. And so you can see that these standards, they focus very much on the implementation and the context of interventions. So the how to plan prevention rather than what to do. And that makes them very attractive, I think, because it means that no matter what kind of approach you're interested in, you can always use the standards to develop your own approach further. Within each of the project stages, there are then what we call components. They're like the little sections. There's 35 of them. And then for each of these components, we have this is a screenshot from the manual, so this is what you find. The component title, an introduction which tells you why the standard is important, and then on the right-hand side, the actual standards, yeah? Saying what would we expect from a project that is of high quality at that stage. And we distinguish between basic standards and expert level standards. The basic standards are the one that we think everybody should aspire to, regardless of whether it's a small or large organization, whether they have a lot of money or not, whether they conduct a program with 1 participant or 1 million participants. Everybody, we think, should try and consider the basic standards. And speaking of basic standards, this leads me to EQUS. EQUS stands for Minimum European Quality Standards in Drug Demand Reduction. It proposes European-level minimum quality standards for 3 areas: prevention, treatment, and harm reduction. And I'm very pleased to see Ambros Uchtenhagen here in the first row, because he was the project lead on that project. This was a separate project from EDPQS, and it was conducted roughly around the same time. So we were just finishing our standards, and and this initiative was started and funded by the European Commission because they're very interested to have political support for a consensus on minimum quality standards in drug demand reduction at a national policy level. Ah yes, and of course, Professor Uchtenhagen has the presentation in the afternoon on treatment. So what do EQUS look like? It's a short list of minimum standards. There's 33 standards for prevention, 22 treatment, 16 on harm reduction. The structure is different from the project cycle I showed you before. There's just 3 headings: structural, process, and outcome standards. And I've included here again a screenshot, just the first 4 standards for prevention. So you can see it's a much shorter document, just a few pages. And I have also included the full list of the EQUS prevention standards in the conference proceedings. So if you're interested, you'll be able to find that there. Now, what is the relationship between the 2 projects? So EQUS prevention is actually the same as EDPQS, because what we did was we didn't just repeat the work we did. Of course, we used the standards that we had developed, and we consolidated them a lot. So we had to adapt the structure from the project cycle to the 3 headings, so that this is the same one as for treatment and harm reduction. EQUS is about minimum standards, so we focused only on the basic level standards. We cut out the more expert standards, and we consolidated a lot. So we went over and over and summarized it until we were able to come up with this short list. We did not conduct extensive stakeholder consultations because we had already done that for our first project, but there was a stakeholder workshop in Brussels that I know some of you have attended, where we discussed the draft standards before they were finalized. So this brings me to my 3rd point. Why quality standards important? Well, let me ask you a question. How do you know if prevention activity is of high quality, or even of minimum quality? So unfortunately, this is not a workshop, so I can't go around and ask you, but I'm sure each of you would be able to come up with the answer. And it's likely that the answers would differ quite a bit, and I've tried to capture that a bit here in this slide. So maybe some of you will talk about the logic of the activity, others will talk about the quality of implementation, and the hardliners will say everything that matters is the outcome in the target population. I don't care about anything else. Okay. So what is the reality? Yeah? Mostly we find that people stand up here and say, this project is great because the young people liked it. Or they say, this project is great because we delivered 2,000 sessions. Or this project is great because we reached 8 million young people. But is that enough? Is that a good enough indicator of quality? We think that if you want to judge high quality, you have to look at the breadth of all these different indicators for quality. And that's what the EDPQS and therefore the EQUS also are trying to do. So if we take that into account, we can actually say that the quality of prevention activities in Europe is mostly unknown or questionable because they very often focus only on participant satisfaction, coverage, and things like that. Yeah? So how can standards benefit you? I hope that by now you already have some idea about the answer. They define the meaning of quality. They provide you with benchmarks that can help you to judge whether your own or somebody else's prevention activity is of minimum or high quality. They focus on implementation and context so that you can always apply them. But of course, it's not a one-size-fits-all project. But we think that this European consensus can provide a starting point. So you know, okay, other people agree that this is high quality. Let's see what we can do to achieve that. What can quality standards be used for? We see it primarily as a tool for information, education, guidance. So, you know, when you want to read up, do I adhere to the European standards on quality? You can check this. You can use it to develop your own criteria. For example, for funding activities, for self-reflection, where you really systematically go through them and see where am I good and what can I improve further, or for discussion in group settings. And all these things have been done already. I've also included here EQUS as an example of how EDPQS can be used to develop new quality standards, and the 3-city project from Sweden, they have also been using the EDPQS in their work. And what I want to emphasize is that standards are a support tool. They're not intended to be a burden. Very often when people hear the word quality standards, they are scared. They're really scared. Yeah? They think this will mean more work, and they think they will lose all their money. If they don't meet the quality standard, they will lose their job. This is not the case. Yeah? The idea is that the quality standard is somewhere where you can say, okay, I want to get up there. And this is a busy slide, but it's just to show you we have a theory of how we think that quality standards may work, with just to highlight the activities of developing and disseminating quality standards, reaching people in the prevention community, improving their competencies regarding prevention, and ultimately the idea is that this would lead to increased quality of preventive work, and at the end of the day, better outcomes for the target population, because that's what we want. We want to, if we are forcing young people to receive prevention, they should receive the best possible prevention. We don't want to waste young people's time with things that don't work. So now you're all thinking, this is fantastic. After the session, I will go and download this document. So you can find the manual, the big book in English, or so a few other languages, but our most popular product is this quick guide, which was commissioned by the EMCDDA. It is a short introduction to the manual. It contains summaries of the standards and some self-reflection checklists, and it's available in over 10 languages, including Turkish, not translated by me, I have to say. And we also have a website where you can find all sorts of information. You can find more information about other standards such as EQUS and UNODC standards and COPOLAT activities in this area, because our website focuses on our own project, but we include the information and the links to the other activities. We also have an other languages section, and if you look there, you will find also the link for Turkish. At the moment, we only have the quick guide, but maybe in the future, maybe some of you want to translate some materials, and we can also add them to this website. And we're also developing more resources at the moment, again with support from the European Union, targeting different professional groups, commissioners and funders, prevention providers, trainers. If you're interested in delivering a workshop on quality and prevention, in a few months you will find resources on the website to help you do that and to introduce our quality standards to your audiences. If you want to disseminate the quality standards in your local community or in your organization, in a few months there will be these materials available. Currently, there's no support materials specifically for EQUS available. However, there is discussions ongoing at the Horizontal Drugs Group and the Civil Society Forum. So I think this is an area where we can expect more activities in the future, and perhaps Ambros will be able to tell us more about that. So in summary, basically the idea is that there are all key efforts to promote quality and prevention. EDPQS focuses on high quality and prevention only. It was developed by our group. Then EQUS is about minimum quality and covers the breadth of drug demand reduction and was led by the group in Zurich. And then I also want to just acknowledge, like I already said, that there are also other quality standards available. For example, the UNODC standards, they focus on what works, so they focus on the content of interventions. And that's it from me. Thank you very much. Teşekkürler.